Hi. So let's go to the next question. Here, the nurse is preparing to suction a patient endotracheal tube suction. Okay. So after ventilating, which of the correct sequence action for the nurse to follow during suction? So the step it is option one is given: apply suction, insert a sterile catheter, and withdraw while rotating the catheter. The second option is insert a sterile catheter, begin to withdraw, apply suction, and continue to withdraw while rotating the catheter. So the third is apply suction, insert a sterile catheter, and withdraw without rotating the catheter. Fourth, insert a sterile catheter, begin to withdraw, apply suction, and continue to withdraw without rotating the catheter. So let's see which one is correct and which one is not correct and why they are wrong. Now the correct option is, so the nurse would ventilate the client, okay? That is the first thing. Ventilate the client first. Then insert the sterile catheter with, so when you insert, don't apply pressure, okay? Without applying suction. The nurse would then withdraw the catheter about 1 inch and apply suction while rotating the catheter. So, ventilate the patient, insert the catheter, okay, and then after that you withdraw about an inch. Then you apply suction and while rotating, okay. So the actions 1, 2, 1, 3 and 4, why wrong? There is certain steps which is not correct. Which one is suctioning on insertion unnecessary? So it decreases oxygen in the airway. So if you insert the catheter, then you keep suctioning the initial itself, you are removing the air from the uh, airway. So you are decreasing oxygen in the airway. So don't do that. When you insert, no need. Then after that, it's insert, withdraw, then supply means suction. Then while withdrawing, you rotate. Okay, that's what the correct step. Then suctioning insertion unnecessarily, that decreases airway. The same. Failure to withdraw and rotate the catheter may result in damage to the tracheal mucosa. So if you reach the end, then if you don't withdraw, maybe you are going to damage the tissue inside. That's why it's instructing to withdraw a little bit an inch. Then you rotate. If you don't rotate, also there's a chance that you are damaging the tissues. Okay, so tracheal mucosa, damage to the tracheal mucosa. So let's go to next question. Next question is nurse assessing diagnose a parathyroid disease. Okay, the client is having abdominal cramping. So the parathyroid client is abdominal cramping, then positive Vostok sign and Trousseau signs and tingling in the extremities. The nurse knows that which of the finding would be a sign of symptoms which are following. Okay, so this patient is hypothyroidism, parathyroid disease, and the patient is having Vostok sign and Trousseau sign. So let's see what are the options here. The patient is showing some symptoms, so you have to determine what is this, why this patient is showing what electrolyte, which one is low in this in person's body. So the first is showing, because this signs, this Vostok sign and Trousseau sign is shown by the patient who is having hypermagnesemia or hypomagnesemia or hypercalcemia or hypocalcemia. So let's go to the rationale what it is given. The person with hypermagnesemia would not exhibit all of these symptoms. Okay, so the symptoms are cramping, abdominal cramping, and positive Chostek sign and Trousseau signs and tingling in extremities. These signs are not shown by a patient who is hypermagnesiemic. The same thing also, the person with the hypomagnesemia might exhibit a positive Vostok sign but not the result of symptoms listed. Okay, then a person with hypercalcemia would not exhibit all of these symptoms. So the only possible here is hypocalcemia. If the patient is in hypocalcemia, this patient demonstrated abdominal cramping, tingling of the extremities, and tetany. Vostek sign refers to an abnormal reaction to the stimulation of the facial nerve, such that when tapped at the masseter muscle, the facial muscles on the same side of the face contract. So if you tap on the masseter muscle, what will happen? It will twist, contract. So the facial muscles on the same side of the face contract, causing a brief twitching of the nose or lips. Nose or lips will twitch. Okay, that's what happened. That is the Chostek sign. So if you tap on the masseter muscle, the same side, not the opposite side, the same side will twitch. Okay, the facial muscle will twitch. Then the nose or lips, it will. Then Chostek sign can be seen in hypomagnesemia also and hypocalcemia. Okay, and in both situations you will see this Chostek sign. Then Trousseau sign of a latent tetany is more sensitive than, this is more sensitive than the Trousseau sign is more sensitive than gender Vostek sign. Okay, sign in hypocalcemia, and may be positive before gross manifestation of hypocalcemia, specifically tetany and hyperreflexia. So a blood pressure, if you blood pressure you keep on elevating more than the systolic, so what happens is pressure greater than the systolic pressure and held it there for 3 minutes, what happens is that it causes an occlusion in the brachial artery. So and brachial artery, there is occlusion and hypocalcemia. That will happen. Subsequent neuromuscular irritability takes place. That will induce what happens? So the muscle spasm. Okay, and the muscle spasm of the client's hand and forearm. That's what means if you apply a BP cuff on patient arm, they raise more than the systolic blood pressure and held it for 3 minutes. So an occlusion of brachial artery takes place, and hypocalcemia. So that will give subsequently it will show a neuromuscular irritability will show, and a spasm development in the forearm and patient's client's forearm and hand. Okay, that's what happens with the hypocalcemia. Okay, so abdominal cramping, Chostek sign, Trousseau sign, tingling of the extremities, everything happens with the hypocalcemia. Okay, now next question, we can go. A 70-year-old presented to the emergency department with shortness of breath. Shortness of breath, crackles in the base and middle of the lungs, filled bilaterally. Okay, and 2 plus pitting edema bilaterally of the lower extremities, and a weight increase of 6 pounds in 1 week. His heart rate is 82 and his blood pressure is 162/90. Per physician's order, the nurse administered 40 mg of furosemide intravenously, means loop diuretics she administered. The nurse knows that which of the following indicate the effectiveness of medication. So you have administered 40 milligram of Lasix furosemide. So you are looking for the effectiveness of the medication. So first is the option, there are 4 options here. First is heart rate of 58. The blood pressure, second option is the blood pressure of 100/52. The urine output, third option is urine output increase of 200 ml over the next hour. Fourth one is a diminished lung sounds bilaterally with the crackles in the bases. So let's see what are the rationale given here. So the first, heart rate 58 could indicate a side effect of medication. So if it is bring the heart rate is low, it is a side effect. Okay, not the therapeutic effect, rather than effectiveness. This significant drop in heart rate would be cause of an alarm, especially after the administration of furosemide. So that's a side effect. Then second one, the blood pressure of 100/52 could indicate a side effect of medication, again rather than effectiveness. This significant drop in blood pressure would be a cause for alarm, so especially after the administration of furosemide. So the third option is the correct option because you gave diuretics. So of course the urine output will be more. So the nurse would expect an increase in urine output after the administration of furosemide. The client presented with signs and symptoms of hypervolemia or fluid overload, including shortness of breath, crackles in lung bases and edema. Weight gain and hypertension can also be an indicative of hypervolemia. So, the goal of treatment using furosemide is diuresis. So, with the care not to send the client into hypovolemia. So, you have to keep in mind that means you are treating for hypervolemia and you bring the patient to hypovolemia by maybe the drug is excess, or so you have to monitor the patient is going to hypovolemia, so that also has to be monitored. Then the nurse would the fourth option, why it is wrong, the nurse would expect to auscultate a reduction. So when you auscultate the lungs, you'll get reduction in the crackles. Okay, if may not be eliminated, if not elimination of crackles in the lung bases. The nurse would also not expect diminished lung sounds because this could indicate atelectasis. If the lung collapses, that's actually, if the breath sound is less, means lung sound is less, that means some other problem, or decreased airflow through the lungs, that is what it indicates. So you don't expect that, means a lung sound has not decreased. Then the goal would be baseline or clear lung sounds. So that is your goal of giving that diuretics. What will be, you are expecting clear or decreased, okay, sound bilaterally with minimal or no crackles in the lung bases upon auscultation. When you auscultate, maybe no crackles or decreased, that you expect, but never the lung sound. Okay, okay, let's go to the next question. The critical care nurse is caring for a client with an arterial line. The nurse can utilize this line for which of the following? So you have an arterial line. What you can, this line can be used for what? That's a question. So first option is monitoring blood pressure and heart rate and infusing medication. Then second option is monitoring blood pressure and heart rate and obtaining blood gases and other laboratory samples. Third is monitoring heart rate, obtaining blood gases and other laboratory samples and infusing medications. Then fourth option is obtaining blood gases and other laboratory samples and infusing medications. Okay, so let's see the rationale. It's when you see an arterial line, no to drug infusion. Okay, so that keep it in your mind. So no drug can be infused through arterial line. So the correct option is arterial lines are used for monitoring blood pressure and heart rate, especially in clients requiring a use of vasopressor medications intravenously. Okay, that is intravenously. Okay, they are also used for clients requiring frequent blood draws. The nurse may also draw arterial blood gases and other laboratory samples from the line for arterial blood samples. Okay, arterial blood gases like that. The following the proper procedure. This saves the client from frequent arterial and venous draws. Okay. Medication should never be infused through an arterial line. Okay, so that makes all the three other options. You can eliminate all that options. Okay. The next question is okay. An 82-year-old woman is admitted with a diagnosis of rapid atrial fibrillation. The nurse has initiated telemetry monitoring per the physician's order. 2 hours after initiation of monitoring, an alarm sounds at the central monitoring station. The client is in what appears to be a ventricular tachycardia. Which of the following action should the nurse take first? So you have a client, she is 82 years old, admitted in the unit with atrial fibrillation. After 2 hours, you are noticing that in the central monitor, this alarm is showing VT, ventricular tachycardia. So there are some actions you have to do. So let's see what is asking you to do here. First call at code blue. Second is silence the alarm and change the alarm parameters. Third, notify the physician of a change in rhythm. Fourth is assess the client and check lead placement. Okay. This is an easy question, I think. So first you have to go and assess the lead placement and the assess patient. Okay. Here, correct answer, assess the client first, then the equipment for disconnection or malfunction. Check lead placement to determine if the monitoring results are indeed accurate and not due to interference or an artifact. Then, if assessment of the client reveals true ventricular tachycardia, follow the advanced directive as established by the client, including but not limited to calling a code. So, you see, this patient is DNR or DNI or so whatever the status is, but still to reach that level, you have to care this patient. But here, first thing, what you have to do, you check the patient lead. Then after that, if everything is okay and it's a true ventricular tachycardia, from there you start to give treatment for this patient. Why option 1 was wrong is this would be a premature on the part of this calling code blue. Okay, then verify alarm limits with the physician and only change the parameter following. If you can't change the alarm limit by your own, you have to get consent from the doctor, or doctor has to change the limits parameters. If something is changes, then okay, so you are not doing it yourself. The nurse would first check the lead wires or access and client ensure the information in the physicians are correct. Okay, then you check the it's everything. If you confirm that it's a real true VT, then you are calling your physician and give information to him. Okay, for you required a consultation. Okay, so thank you for watching. I'll be coming with the next video soon.